All right, fantastic. So you've decided to go to insuremesteve.us/rigged and find out how to change the game in your favor against the healthcare industry because the industry is rigged against you. So you've gone, you've watched the video, you're ready to change the game in your favor. And you've started talking with health insurance agents. Maybe you put your information into lead forms that are available on the internet. You probably put your name, your phone number, your email, your date of birth, whether you smoke, and what zip code you live in. And if you put it in the wrong ones, I'm sorry to say you got inundated with a bunch of calls you didn't really need. But let's say you started booking those appointments with those insurance agents. What are the top 5 questions that you should ask when you're looking at and evaluating different health insurance plans? Well, that's what I want to talk about here today. And I'm not going to go through, the fifth one down to the first one. I'm going to give you the first one first because it's god darn important. All right. So the number one question you should ask the health insurance agents that you are now beginning to meet with, regardless of whether you meet online, by phone, or in person, you should ask, can I record this meeting? Can I record this meeting? Because if they say no, they are likely an unethical agent going to mislead you in the coverage, misrepresent the coverage, or omit parts of the coverage that doesn't put it into a good light. Any ethical agent should have no problem being recorded in their sales presentations. The number one question that you can ask is, can you record the meeting? And if they say no, run. All right, number 2. The number 2 most important question you should ask is this insurance? But specifically, you should ask, is this regulated by my state's Department of Insurance? You see, across all the states in the U.S., if it is an insurance product, it must be filed with the Department of Insurance, and it is regulated as an insurance product by that department. The reason why this is important is because there are products out there that look like, smell like, and feel like insurance, but they're not. These are sharing plans, and the representatives sharing these plans typically lead you to believe that it is insurance. And so asking really blunt questions about whether the product they are representing is regulated by your state's Department of Insurance will be an important question to ask. And if they say no, run. All right, here's a bonus number 2 question for you. So if it is a regulated insurance product, they must be a licensed agent to sell insurance. So the bonus number 2 question is, are you a licensed insurance agent? And if they say no, run. All right, number 3. Number 3 is the most common question that a lot of people ask, and it's a really, really good one. Is the network that the insurance has a PPO network or an HMO network? Now, PPO networks are typically what people want. And those are the broader size networks. In fact, a couple of days ago, I shared details on the biggest PPO network in the country and how it's used across several different plans. I think about 1,600 plans use the largest PPO network in the country. HMO networks are typically smaller. You typically have to identify and appoint a primary care physician as being part of that, as being insured in that network. And you have to run all your care through that primary care physician, meaning they will need to refer you out to specialists. All right, so here's a bonus number 3, though. All right, you asked, is it PPO or HMO? But what you want to know is it a local regional network or is it a national network? All right, because if you travel out of your region, then you're going to be paying out-of-network cost for any care that you require when you're out of your region. So these regional networks, they could be in your state or they could be in a geographic region of your state. And when you travel out of state or out of that region, you're going to be paying the out of network cost for any care. With a national plan, you'll have access to a PPO network across all 50 states. And your agent should certainly provide you with a provider search. So regardless of where you are in the country, you can find the care that you need. All right, number 4. The number 4 most important question is, how will the plan handle any pre-existing conditions? Pre-existing conditions are any type of medical condition that you had prior to getting the insurance. Now, with Affordable Care Act compliant plans, they no longer can deny coverage for anybody who has pre-existing conditions. As long as they're willing to pay the premiums, they can't deny you coverage. With underwritten plans, however, they handle pre-existing conditions differently. They can deny coverage, but more importantly, they may provide coverage after a certain number of months. The typical range of time is about 12 months. So after you're on the plan for 12 months, you can receive benefits for any care related to your pre-existing condition. Now, this isn't necessarily bad, because when the Affordable Care Act required these insurance companies to no longer deny coverage to anybody who could pay their premiums, what did they do? They raised the cost and they raised the deductible and out-of-pocket limits. And so if you have a pre-existing condition, you're likely going to be paying cash, or you're going to be paying it for yourself to reach that deductible. And with these underwritten plans nowadays, you can actually lower your premium, and it may make sense, economic sense, to pay for the care related to that pre-existing condition for the wait period. Maybe it's 12 months, because you're lowering your overall cost of health insurance. And I'm going to talk about that later on in another video, is what is really the mathematical equation for the real cost of your health insurance. All right, and the number 5 most important question, and this is really important for growing families. If you are a young husband, a young wife, and together y'all have plans to grow your family and have children, then you need to know how maternity benefits will be paid underneath the plan, will be covered underneath the plan. You need to know that the appointments leading up to the maternity, to the delivery, and the delivery and appointments after will receive coverage underneath the plan. Now, Affordable Care Act compliant plans must provide maternity benefits. In a pregnancy year, you're very likely going to reach your deductible. But underwritten plans don't have to provide maternity benefits, and many do not. And here is the key. This is why it's important that you ask, does the plan provide maternity coverage? Because some agents don't want you to know that. It is the downside of underwritten plans. And so they will show you all the good side of the underwritten plans and leave out the negative parts. And lack of maternity benefits for a growing family is a big, big negative. So those are my 5 top questions. So hopefully you've learned that the healthcare industry is rigged against you. And now you're starting to look at how you can rig the game in your favor. These are the top 5 most important questions you can ask the health insurance agents that you start to talk with. If you're interested in not wanting to meet with me, then I'm available. We can meet, and all you need to do is go to meetstevestump.com, and you can ask me these questions. I'll be happy to answer them, and yes, you can record me. Thanks for listening. Be sure to hit subscribe and like, and you'll be able to listen to further updates, future updates in the coming days. Thank you again. Bye-bye.